So welcome you all for today's presentation, exactly 7 o'clock, 7 p.m. on dot. And we have here Lakshmi Parameshwar, is a world-renowned expert in psychotherapy and psychology, clinical psychology. We are very, very fortunate to host this program, Trauma, Recovery and Healing. We have a series of Zoom webinars, free webinars, to produce some use for you, mentally, physically, emotionally, in every level. And then she is going to bring us a wonderful experiential tool, practical tool, which you can experience it in person at Arsha Vidya Gurukulam on November 2nd, 2023, which is in Pennsylvania. The nearest airport is Allentown, and you can fly to Bethlehem, Philadelphia, as well as EWR, also New York Airport. So very comfortable. In conjunction with, we are going to do 56th International Conference on Ayurveda for Women, a 3-day conference. So pre-conference 1 day with healing with trauma healing through healing, trauma recovery and healing. 1 day workshop is a 6 hours workshop, morning 9 to 12 and lunch break 12 to 2. And again, 2 to 5, 6-hour session. We have a registration link is available. We'll be sharing with you, all of you. And before that, and I would like to chant recitation. Of course, we have an Neil Parameshwar is here. If he is able to chant, that will be wonderful. Otherwise, I will chant. Pandit Neil Parameshwar. Okay. So what I will do, I will chant Dhanvantari Stavanti to give the auspiciousness for this Zoom webinars today. Om Namami Dhanvantari Madidevam Sura Surair Vandita Pada Padmam Loke Jarargbhaya Mrutyunasham Dataramesham Vividaushadinam. Om Shanti Shanti Shanti. As I explained to you, our beloved speaker, Lakshmi Parameshwar, a licensed clinical psychologist and world-renowned speaker, has plenty of experience in the clinical psychology. We are very, very fortunate to have first webinar with her. And we'll, in conjunction with you, have any questions, or they will take the time for questions and answers. You can, in the chat box, you can put all the questions. The flow will not be interrupted. And this webinar link is available on our website, and we will also share with all the people. More than 113 people registered for this Zoom webinar. Some people, they cannot come, but they will enjoy this session after the Zoom meeting. Thank you. Lakshmi Parameshwar ji, namaste. Come in, and you are muted. Yeah.
Namaste, Dr. Shekhar. Thank you so much for this opportunity to meet with your network of people, all committed to Ayurveda. I'm assuming that. And it's a real privilege and honor to meet with you on Zoom. I have a small request, as many of you can turn your cameras on. I would appreciate that, because I want this to be an interactive session. I'm going to talk a little bit about what I have in mind for the workshop on November 2nd. But in addition, I want to respond to your queries. And I want to customize the workshop based on your needs. So the participants who are going to be attending the workshop Because trauma is a very big topic, and you can't really understand your own traumas in a one-day workshop. However, my goal really for that particular day is to have an experiential all-day interaction with you where you understand what trauma is. I'll be talking about different kinds of trauma, chronic trauma, complex traumas, episodic traumas, systemic traumas, because the field is huge. Childhood traumas, and I'll kind of talk about the intersection of all those traumatic experiences and how that affects us in the moment and in the present. So my goal really is to help you explore internally to figure out what are some of the areas in your life that you think is interfering with your ability to function to the best of your ability. So it's kind of an inner exploration, and to figure out ways, strategies, and ways to understand your own traumas. What are some of your own patterns that you have been using over the years to deal with your traumas? Some of those patterns work and some of those patterns don't work. And we'll be doing this. I'm not going to sit and talk at you all day. I have done workshops quite a bit over the years, and that's one thing I cannot do. I can't listen to myself all day. What I need is an interactive session. And all these experiential tools that we'll be using to uncover some of our traumas. And also, I want to make sure that we don't just uncover it, that we actually talk about what are some of the things we can do, what works, what doesn't work, what are the traps, the psychological traps, the emotional traps, and how that affects our relationships in the moment, in the present. So everything, when you talk about leading a healthy and a normal life, normal in quotes, it's all on a continuum, right? I'm sure that we all agree that, life is a series of ups and downs. And there are so many things that we are affected by. We are a sum total of all of our genetics, our upbringing, our environmental experiences, our relationships from the past. And we find ourselves at this moment in time doing with what we need to do today. And the fact of the matter is that there is such a deep connection between the body and the mind. And that's why I want to talk a little bit about why I'm choosing to do this in this platform in the global Ayurvedic community, as Dr. Shekhar has been involved with for so many years. And it's been such an amazing interaction with him that I've had. And I'm really enjoying this. I presented at last year's conference, right, Dr. Shekhar? I forget what, in the springtime.
April.
Yes, this year in April. And I met so many people from your group. I'm not sure if you have anybody from that group here today, but I met so many people even after that presentation. And there was so much synergy about Ayurveda as a lifestyle, as a branch of medicine, and the psychological and emotional aspects and the mental health aspects of our lives. So I thought it's a good way to sort of talk about trauma in that context with that population, because you already have an understanding of the body-mind connection. And we will just be delving deeper into trauma. Again, I don't have a prepared presentation today deliberately because I want to hear some of the things and what your expectations are, but I'll just go through with you some of the things that I would like to cover on that day. As I said earlier, I want to talk about, first of all, what is trauma? What are the different kinds of trauma? How can we recognize trauma too? Because a lot of times people feel anxious, they're depressed, they're not able to sleep at night. Maybe you just feel a sense of hopelessness, or you're lacking a sense of confidence in trying to engage with the world. and you don't know why that is. Jobs are, not that great all the time. I mean, you're lucky if you're working in a job that you enjoy. There are financial issues, there are relationship issues. It's hard to raise kids. It's just hard. Life can be really, really hard. And sometimes we don't understand why. Because on the surface, everything seems okay. Yes, I've had a decent childhood, but why is it so hard? Why am I not able to sleep? Why am I so troubled? And not only about our own personal lives, but even what is happening in society at large. Why is there so much anger? Why is there so much hatred? Why do we find ourselves reacting in ways that we do that can sometimes cause problems or affect our day-to-day functioning? I once had someone tell me that they had so much of rage inside of them that she didn't really understand why that was. On the surface, she couldn't figure it out, but she was unhappy in her job. She was having difficulty getting along with her adolescent kids. So there's so many things that we go through and we don't understand why that is. And a lot of times it is because of unrecognized traumas or unrecognized experiences as we grow up, how we were parented ourselves, how our worldview was formed as we were growing up. And then you realize, then you come to a point when you feel like I need help, or I need to address this. I deserve to feel better. I deserve to do better. And then it makes you think about what are some of the things that you can do. So this is really our attempt to provide you with that opportunity to understand what trauma is. It's certainly not a self-diagnostic endeavor, and I'm not going to be diagnosing anyone. I don't diagnose people anyway. But it's not an endeavor to kind of make you sick or suggest that there's something wrong with your life. Maybe your life is great, but then you figured some things out if you're able to function at that level. So because there's a tremendous need in this area to understand what makes us tick and what are some of the choices that we have in dealing with our traumatic experiences. So that's basically kind of the overall agenda for the day. And what I'm going to be doing is I'm not going to just show you a series of PowerPoints. Okay, I am going to show you a couple, but I'm not going to show you PowerPoints all day. My goal really is to use therapeutic tools to uncover and to understand some of the experiences that you may or may not have had, so that we can have a conversation in the group. If we have a large group on that day, Dr. Shekhar, my goal really is then to break the group up so that we can do some small group work, because I want it to be meaningful and I want it to go a little bit in depth. And it's hard to share about your life in large groups. I mean, some people do it, but it's harder to do that. So we will figure out a process where we do all of the exercises and we uncover and we talk about it, identify solutions. So there will be a group work. There will be other experiential ways that we will do as a larger group. So there are a lot of things that I have in mind. And just recently, I launched a tool, actually, a therapeutic tool called Staying in Your Lane. I first launched it in India in June, and it was received very well. And there's a bunch of research that's going on right now. We're trying to get some evidence-based research to understand how effective or ineffective the tool is. And as the studies are going on, I'm getting good feedback. I use it in my own private practice as well. And I also use it to train other therapists, because primarily I'm a clinical supervisor and a trainer and a teacher. So I also, have been teaching that tool, and I'm looking forward to using that tool with this group or whoever plans to attend that on November 2nd. And as Dr. Shekhar said, the focus of the conference really is Ayurveda for women. But this particular pre-conference is open to everybody. And trauma is trauma. It doesn't matter if you're a man or a woman. So it's a more personal sort of an experience. So my goal is to have it open to every. Is that okay? Are only women registering for this, Dr.
No,
Shekhar?
it's men also can come.
Men also can come. Okay, because a lot of times you have couples who come for these conferences.
Certainly.
And you know, other family members come. So, you know, we'll make it work. Once I understand exactly what the group is going to be like, I will customize it in such a way that we will be able to offer you a program that we hope is beneficial for you. I'm going to actually at this point, I don't know how many participants do we have, Dr. Shekhar, right now?
Let me check. And here we have group of people. Let's see, all people are here. You as a gallery.
Actually, it doesn't even matter.
We have about 11 people are here. And what we do also, it's interesting that the concept of trauma in Ayurvedic perspective, if you look into that, Abhigata. Abhigata. Ghata means injury. Something is happening, Abhigata. Abhigata can be Sharirik Abhigata, Manasik Abhigata, and spiritual. So here we are talking about the psychological trauma.
Right.
Or physical trauma like an accident, something happened to you, or somebody physically handling you, something like that. That can be physical trauma. Physical trauma can affect on the emotional trauma or psychological trauma. Sometimes psychological trauma can also affect on the physical level. And we have seen in our practice more than 30,000 patients, we have seen that there is a certain types of diseases. Even people think about that diabetes, arthritis, Alzheimer conditions, or insomnia, menstrual problems, menopausal conditions, or simple disturbances in their position as studies, students, children, and everybody who can affect in the various levels. These traumas can be affected in the various levels. What we are trying to do it here in our workshop, this November 2nd, we are doing in the Arsha Vidya Gurukulam, where the workshop is happening, 6 hours workshop. That means we are spending about 8 hours with the teacher, and who is experienced, clinical experience is there. You are spending with all the group of people. We are having a group of people divided according to the, it will be closed circuit like that. It will be discussed in such a way that compassionate and everything, compassionate way. And we will discuss everything, keep it of work in a confidential manner, and share the individual personal experiences and come up with the outcomes, nice, beautiful outcomes. And I can see that the day when it starts and the end, people are completely blossomed like a flowers. Like a flowers, you feel that the blossoming of the healing. And after that, you can see that, okay, we are going to see the pulse and analysis and everything we do it. My God, I feel better than the pills. I feel better now. I feel this workshop is really tools, and Lakshmi Parameshwari is going to give you a tools for you to take home. That's the thing. Take home program is there in that program, where you can take the tools, and those tools which can be adapted into your day-to-day practice, and as well as the people who are practitioners, Ayurveda practitioners, Ayurveda clinicians who are coming, the yoga teachers, and the psychologists and psychotherapists and psychiatrists. Some of the psychiatrists also participating in our conference. And those people can take these things. Not only that, a lot of psychiatrists also think about that. Now, open-minded psychiatrists. I'm not talking about the closed psychiatrists and psychiatrists who prescribe the medications, diagnose the diseases as a board-certified psychiatrist. And those people also open to these things. They are also happy to help the people to not to prescribe too many medications on the people, because they know that a lot of side effects are there, medications and everything. Even the Ayurvedic practitioners, they prescribe some of the, recommend some of the herbal formulations. We as an Ayurveda practitioners, we don't recommend the people to take long-term herbal formulations. Oh, Dr. Shekhar, ashwagandha is good. And I will take 10 kilos of ashwagandha, or turmeric is good, or Brahmi is good. There are so many herbs are there. You can't take like that. There is because body chemistry is changing. We are changing. You are
Right.
not exactly same yesterday and today. You are different. You make sure that you are changing, you are witnessing every day you are evolved into the greater human being, greater evolved soul, like that. So you are different. You are not, your name is the same, your date of birth is same, your lifestyle is same, your job may be same, but you are different. You are different. Make sure that this witness is happening, because when we have a trauma is happened, we are completely in the cloud. We are in the cloud. In that cloud, we have to come out. When we come out, we have clarity is there more. And when the clarity is there, then you will able to find your purpose of life. That is, a lot of people, they try to look into that. Okay, my life, a lot of times I ask the question also, what is, does your life is purposeful? And not at all, hopeless, useless, and unhappy, like this. Several questions they look into that way, and a lot of people, they are not happy with their what their purpose of the life. So first we have to find the purpose of the life, and whether you are happy or not. So how do you know that whether you are happy or not? Simple thing I will tell you is a practical experience for you. Put your hand, one hand on your head, one hand on your heart, and close your eyes. Connect yourself from the mind to the heart. How much you are connected? Are you feeling a big wall between the head and the heart? Or you feel something is a fluid is flowing from the head to the heart, heart to the head? You feel the connectivity, you're feeling that connectivity, then you are happy. You are started to working on that. The flow of energy between the heart and the head. And a lot of times we think something, we react something. So somebody says that, Dr. Shekhar, my heart is broken. What do you mean? Heart is broken means your heart is chambers or four walls are broken. Or if the divorce is happened something recently, she is broken my heart, or he is broken my heart. What do you mean? We have to go to the cardiologist and have a check that, doctor, I broken my heart. No. Where is broken? If the brain is broken, neurologist, we have to go to the neurologist and ask him that, hey, I have a brain chambers are there, brain left and right hemispheres are there, they are broken. So we have to look into that, how we are lost that connectivity and everything, and that is affecting a lot. And one psychiatrist and psychologist says that we are all mental. We are living in the mental world. So, bhinne bhinne mater buddhihi. The word very beautifully they mentioned that bhinne mater buddhihi. So that means here very clearly mentioned that you cannot understand yourself. A lot of times we don't know who we are. First of all, try to understand yourself. Then you try to understand your wife, your children, your parents, your family, your country, your country president, and everybody you can understand. That's the way. What we needed to look into that first, these tools really, and I see that thousands of patients, when we see these people, that really they have not physical problems. They're coming to see us as a physical problem. When you boil down to that direction of everything, that there's emotional trauma is there. Emotional trauma is there. That is the thing. That is the thing as an holistic psychotherapist and mental health workers and all the people are Ayurveda practitioners, yoga teachers, hypnotists, all the people, what they do, they listen to you. They are not judging you. They are not judging you. They are not analyzing you. They are not criticizing you. They are holding your hand. They are holding your hand and having a support to you. You are sinking into the water. Then just they are giving the hold of the hand. With that hold of the hand, you are taking the step forward, coming forward and everything. You see the step-by-step improvement. After that, de-addiction to the emotions, de-addiction to everything, de-addiction to anger, frustrations, and sadness. Why we are unhappy all the time? Why? This is the birthright to be happy. Our birthright. We have to say loudly every day that this is our birthright to be happier and happier and happier. And Dr. Shekhar, I'm happier. How much happier? 20%? 30%? No, I want to be 500%. Make sure that you are living in a full potential, full happiness, in a blissful state and everything. Then you don't need to have any anti-aging starts. And a lot of things now, majority of the diseases. Today I was talking to one of the cardiologists who came to see me, and then we were talking about that, Shekhar, we see that a lot of people, emotional problems are connecting to the heart diseases. Even your cholesterol is connected to the heart disease. Even your diabetic medication is connected to these things. And your psychiatric problems, all the conditions are somewhere it is holding there. We have to hold it. And we are lucky to have here our dear friend, Manuel Matis, who is a psychologist, psychotherapist, clinical psychologist from Miami, Florida. Holiday. Somewhere.
Harmony is a small town southeast of Orlando. So it's in Central Florida. And I'm a clinical social worker. I changed careers. So my bachelor's is in landscape architecture. So I studied horticulture and herbs and healing plants and healing herbs.
Lovely.
So now I work with harmonizing man with nature, because we live in a mental world. We live in a synthetic society.
Yes, we do.
If you think about it, especially with artificial intelligence and all this pressure to get it to dive into that virtual world. And we're disconnected from our body. Trauma disconnects us from our body. We go into fight or flight survival.
Completely.
So we need to find a way to help our patient dive back into their body. If you think about it, though, we live in a society that teaches us to be afraid to do that.
Yeah.
And because if you think, how many times have you heard somebody say to you or someone near you, "Are you out of your freaking mind?"
Yes.
So that implies that you're supposed to be in your mind if you're going to be normal.
Right.
Well, when the whole world is crazy and you're trying to pursue normal in a crazy world, something's going to be out of whack.
Yeah.
So
I think 90% of the work that we do is getting people out of their mind. Getting out of your mind and coming into the moment, coming into the present, coming into, living in the moment. That is if we can put that in a bottle and sell it, that would sell.
Excellent. Lakshmi and Manuel, what you mentioned that, yes, we are living in the shell, inside in the shell, and we are continuously thinking process like that. Self-esteem, self issues are coming, harmonizing, and sometimes people will come with excessive eating of sugars, alcohol, drinking, smoking habits, or sexual abuses, or there are so many things can happen to their family members and everything. And then that leads to now drug addictions and now recreational drugs coming to in the field like that. Okay, legally fighting for that type of thing. And then identity crisis, loss of identity crisis. So many things are happening, and these are all the traumas are there in any direction. Like hurricane can go and travel anywhere, whatever the direction is suitable for that way.
Right.
And being a people who are living in Florida, they know that exactly how the hurricane starts. It can start everywhere and it can move everywhere. And everywhere, every time we can see this, the wildfires are happening and trauma is happening, losing their houses and children and their beloved cats and dogs and pets and everything they are having.
Yeah.
All the issues are coming. We can answer for these things on November 2nd.
Right.
And
Yeah.
experience it in person, hold your hands, learn these things, and then in journey continuation to that, Women's Health Conference is there, and you can be a speaker.
Yes.
You can come as a speaker and share the knowledge. If you are a yoga teacher, you can join with us. We have a laughter yoga programs are there, and recitation programs and chantings, and so many wonderful things are tools are there to heal your mind, body, spirit. Everything is very wonderful. Manuel, you want to say something?
Yeah, I would like to just kind of highlight two things that you said, Dr. Shekhar. Earlier, you talked about holding the hand, and also earlier you talked about broken heart. So the thing about holding the hand, I totally understand that. I've been working with patients for 25 years, most of it in the mental health area. Unfortunately, this in the United States, the mainstream medicine, mainstream science, allopathic medicine, the holding hands becomes a codependent grab when the pharmaceutical industry and the protocols that the doctors need to follow is just kind of, it's more like hands are pushing the person to the medication, and the person's either going to resistantly go into that or resist it altogether and find something else. So that's an unfortunate thing. The other thing I wanted to say, if I could just kind of finish on the part about the body, Shekhar was talking about broken heart. Think about how many times we say, you know, that person's a pain in the neck, or I have a gut feeling, right?
Yes.
So we have some ideas of, but it's just metaphors that we're using, that were handed down to from our ancestors. Really, we learned it when we were little kids, but we're not really making the connection between the head and the heart, or between the mind and the body. In Japan, I learned something. Hara is what they call the solar plexus area. So I've only seen one book where the author actually put that on the title of the name, the three H's: head, heart, hara. So it's about connecting, stepping away from this thinking presence, and do more like heartfulness, and then connect with hara. And that last part is something that I'm interested in learning more about, because we when we're in the trauma, the gut, the brain gut axis, we get gut dysbiosis a lot of the times, because we're locked into the trauma stuck points. So so I'm interested in learning more about, and obviously breath work. Diaphragmatic breathing and things like that activates that hara region, and the vagus nerve. Vagus nerve activation is super important. So I appreciate everyone here.
Very interesting hara point. Very interestingly brought by Manuel here as a clinical psychologist. Hara word, it is a hara in our language, in Indian language. Hara means a necklace. A necklace which we are wearing. Women, when they are wearing, like a hara, can be a pula hara, means the flower garland, or a necklace of the gold, necklace of the, like a Muruga here, he is wearing the Rudraksha, Rudraksha. So these are all things which are connecting from the head, particularly the occiput area in the back, in the neck area. That is the center point where the occiput is moving. That is exactly stays there. From there to the heart chakra, the heart area, it is connecting. So if you are wearing the necklace, gold necklace, or any silver necklace, or anything, Rudraksha or something, it has to be wear from the Atlas bone to the all the way to the heart chakra. So when you do it this one, what happening? You have emotional traumas or less. If you keep it in the neck, then you are hanging, you are suiciding yourself. Basically, you are suiciding. The suicide person, what they will do? they put in the neck, they kill themselves. That's exactly happening. So that means if you wanted to suicide or you wanted to live connecting the mind body, that's very important here. So it's a very interesting tool you are learning here today, a free tool, wearing the necklace all the way to bring it to the heart area. Whether you belong to your puppy or you belong to your some thing like that, heart or any engagement, something like that, any beloved, something like that, all the things like a Mangal Sutra they wear, that is also bring it to the heart chakra area. So I am connected to you like that. I am always connected to you like that. That's the thing is happening there. So it's very important here. Hara word, even though Japanese word they are using, Hara is the ancient word in India. Commonly use that word. Hara is very common word. That's interesting.
Interesting. It's so interesting to hear this. But I just wanted to pick up on a couple of things that mindful Manny. That's what your title is, and I like that. What you said really resonates, because I think what's happening is that the whole science, so-called allopathic scientific approach to dealing with trauma, etc., is a disease model. You know, it's not about wellness, and the reality is all of the research on trauma tells you that everything is connected to each other. This whole holistic approach, your brain, your everything that happens up here, everything that happens up here. Therapy is described as a meeting of the heart and the head, and making peace with the heart and the head in some cases. Because when you are letting only emotions drive your decisions, you're not always making the best decisions. When you're only letting, cognitions drive your decisions, you're not making the best decisions. It's always a combination of the heart and the head. And in therapy, a lot of times that's what people are exploring. Like, what is it? Who am I really? And what is it that makes me happy? And what is it that I need to live a life that is harmonious within me? So this idea of a disease concept, I think, is what messes up everything that comes with anything related to mental illness, whether it is anxiety, whether it's depression, whether it is anything else, anything more serious than that also. Because the disease, like Dr. Shekhar said, you go to a psychiatrist, they give you a medication. People really don't even understand how these medications work, at least not the psychotropic medications for depression and anxiety. It is not like medication for diabetes, where they actually understand how that works. And it's even questionable there whether you need to be dependent on it all your life, right? Depending on exactly where you are in that spectrum. But for mental health issues, it is basically a trial and error. When a psychiatrist gives you a medication, they're different. There are SSRIs, there are other medications that work differently, but nobody understands what is going to work. And just by itself, medications are not effective. All of the research has shown that for severe depression, for major depressive disorders, you need a combination of short-term medication and long-term therapy. It is the relationship, it is the therapy that really, and practices like all these other things like yoga and meditation and mindfulness, all of that makes a huge impact on how your mental health, how you progress in that sense of reducing your depression and living a more engaged life, when you're more engaged with those around you. So on that day, on November 2nd, really what I envisage us doing is doing a lot of experiential work and tools that you can actually take with you to understand and practice on a daily basis so that you can better manage your own emotions. Okay, because what we cannot control is the environment. We cannot control the environment all the time, but we can control how we react to it. So when we take charge of our lives, when we take charge of our wellness, when we begin to feel that, I can do something here that will benefit me, once you have that approach, rather than being the recipient of sadness, or rather than being a recipient of bad news in your life, rather than waiting for that job where you're going to lose that job and then you will wonder about money. Maybe one way to look at it is that, what does this job really mean to me? What do I really need? And how am I going to go about living life on my terms, on recognizing, what exactly I need to do so that I can control who I am inside of who I am, because that's the only person I can control. And the other interesting thing is that we are all victims of patterns. The way we react to the world, there are involuntary patterns that we develop as we grow up. And as adults, what happens is that our locus of control tends to be very external. We forget who we are, when my name is, Lakshmi Parmeswar. Who am I? Who am I really? Am I my job? I am not my job. Am I my career? I'm not my career. Am I just being a wife? I'm not just being a wife. Am I just a mother? No, I'm not just a mother. It is a sum total of all these things that kind of give you a window of who I am. But the most important thing is, am I connected with who I am, who that person is? So at different points in your life too, you play on certain roles that life demand. When you're parenting a child, for example, when a child is first born, there's a lot of research on attachment theories. I'm sure Manny's heard of this. And we talk about attachment and how it affects our worldview, what kind of early childhood experiences we've had, and how that affects how we think, who we are, how we emote, how we feel, how we react, all of that. And of course, we have genetics as well. What are some of the things that we are born with? Certain personality traits, certain ways of how we interact. Are we outgoing? Do we like people? Do we prefer to be alone? Do we prefer to be with people? All that changes. None of that is constant because we are continuously evolving. The person, I'm much older. I'm probably older than all of you, but the person that I was 30 years ago is not the same person that I am today. And that's because all of us go through life evolving and learning. And it's not a straight line. It's never a straight line. It's like this. And hopefully somewhere along the way, the ultimate direction is going up, but you're actually falling a lot before you end up going up. So this idea that we need to continuously understand that we have the ability to empower ourselves, to control our inner world, to recognize that the way we interact with the world depends on who we are internally. That itself is a beginning step. It's start of the journey of recognizing that you don't have to hold yourself hostage to all of the external things around you, whether it is a bad marriage, whether it is, having difficulty raising kids, whether it is a bad job, whether it is not a very understanding boss, whether it is someone who is close in your family who you feel you have a kind of a dysfunctional pattern with. All of that can be reworked, and it is entirely dependent on so many things that we are in control of that we are not even aware of. And sometimes going through an experiential day, recognizing or just focusing on who you are, spending the time investing in who you are, and recognizing that there are so many things that is in your favor and that you need to reconnect with who you are, or there are parts sometimes in your life when things go really well. You are so engaged, you're so happy, you wake up every morning with a purpose and you know what you're doing, you know how to go about doing it, but you cannot have that throughout your life. It's not a straight line, and nobody has that kind of a story. So we all have our fears, we have our doubts, we have our demons within us that surface in relationships. It surfaces in the way we think of ourselves, in the way we treat ourselves. There's so much of work being done on things like self-compassion. There's so much of work being done on where trauma sits in your body. You know, when you have a chronic illness, okay, and you, especially cancer patients, when you really, I spent a lot of time with cancer patients. There's a fair amount of cancer in my family as well. And when you really look at it, you think about it, you spend time with the people, you realize that cancer really is, there are many physical and environmental factors for it, genetic factors as well. However, that the way cancer trauma sits in various parts of your body. So that's why you have such an increase of psychosomatic illnesses. That is why panic attacks can sometimes look like a real heart attack. It's anxiety unfolding itself. So basically, we hold our traumas within our bodies, different parts of our bodies. Like Manny said, you know, when you say I have a gut reaction, or I have stomach issues, I have severe headaches, I have migraines, there are psychological components for all of that. And the reverse is also true, like Dr. Shekhar said, where if you are leading a life with a lot of emotional traumas and a lot of stress and anxiety and a lot of family issues, etc., it can settle in your body. You contain your wounds in your body and it shows up. And you can see that so clearly. There's so many times when in my life when I felt like something needs to change because my body is telling me stop doing the same thing over and over again. Start thinking about, like, spend time on yourself to figure out what needs to change here. And these are not difficult, these are not easy decisions. These are very difficult decisions, but they're simple. The symptoms are simple that we ignore for years and years and years and years. Until we take the time to say, wait, I need to do something differently. I need to understand why I keep getting migraines so often. What are the triggers? When is there a pattern to how this happens? Should I journal every time I get a headache or every time I'm having stomach issues, indigestion? Sometimes it's not even related to what I eat. No matter what I eat, my body reacts a certain way because something isn't right. There's a disharmony between your mind, your body, your soul. And you know, people talk about neuroplasticity, plasticity in brain research. All of that tells us that we can actually, through our choices that we make, through our actions that we choose to do in our lives, we can actually change the way the cells actually grow. You can actually reverse mild dementia. You can reverse certain things. You can reverse eye issues, vision issues. You can reverse a lot of things when you focus on the body, when you focus on the breath, when you focus on yoga, and when you focus on your inner experience or inner emotional world. So there's a lot of research available on this that talks about it. And I think the hardest thing is to figure out, how do I do it? Or what do I need? Where do I begin? How can I be more engaged and more connected to my body? Like Manny said, when you are going through a traumatic experience, you are completely disconnected from your body. And you are disconnected with yourself. You're disconnected with your soul. You're disconnected with your emotions. And I'm sure a lot of times people in your life will say, well, what's wrong with you? Why do you get angry so much? What is bothering you? Why are you snapping at people all the time? What is bothering you? Or when you begin to feel tired all the time, when you're not able to get out of bed. See, I think the biggest thing that Western societies, or actually everybody, not just Western societies, but there is so much of emphasis on wanting to be happy that we forget that maybe what we need to worry about less is happiness and worry about trying to find a purpose and a meaning, trying to make sense of our existence, trying to figure out, you know, I have this one life to live that I know of. How am I going to make it better? What can I do to be a better version of who I am? And how can I sustain that? what can I do? What goals do I have to improve the quality of my own life? And how can I build the inside? How can I build the internal me? How can I be more resilient to everything that I'm about to face? Because I cannot control the external environment. The only thing I can control is how I react to things. So how can I take charge of my life? How can I take charge of my body? How can I take charge of my mind? And mind, nobody can control the mind. Nobody can control the mind. You can do practices that will help you be comfortable with yourself, comfortable with your thoughts, comfortable with your emotions, comfortable with being in your skin, basically. That's what we need. That's what wellness is all about. So when we talk about trauma, I think what happens is people, first of all, trauma is used very, very loosely these days. Everybody, kids will tell you, I had such a traumatic day in school today. Because culturally, that's how we talk, right? Well, real trauma is something that can be cumulative, that you're not even aware of. Like your little day-to-day stresses accumulate. The way you are in your relationships with people, the way you connect with people, the way you view the world, the way you parent your children, the way you have relationships with your parents, all of that is because that's how we're raised, right? Because we have to understand how we got to this point. So the exercises that we will be doing on that day are experiential exercises that will help you, that will give you a window of who you are. That's the goal, at least. So the idea is to do it in a safe environment, where you feel safe, you feel comfortable, you feel that it is okay to share, and it's very hard to share. It's extremely hard to share. So we will be doing things in a way where you will not be forced to do anything. Whatever you do will be done out of your willingness to participate. And if you don't participate, that is okay too, because we have ways to have you participate and engage without really talking about your traumas. Okay? So it's going to be sort of trying to tap into those parts of yourself that you're not consciously aware all the time. So it's really tapping into the unconscious. And those of you, several of you are practitioners, you probably know a lot about the field of mental health. I will be using a lot of gestalt in my work and process-oriented work. So it's not prescriptive. It's not telling you that this causes this, therefore this is what is happening to you, because that's what allopathy does, and that's the more science-oriented approach. This is more related to you being able to connect to your body, connect to your mind, connect to your thoughts, and connect to how you want to invest in yourself to make your journey better and make or be in charge of starting your journey in the process of healing. Because healing is a process, right? It's a lifelong process, lifelong journey. And there are so many triggers in our lives. So the first thing is, let's recognize those triggers. Let's understand what are the things that are barriers in our way, in the way we live, in terms of how we interact with the world and the quality of our relationship. So that's basically the summary. I don't want to, I think I'm sounding redundant. So what I would, since it's a nice small group, and I love small groups, does anybody have any specific questions about either about trauma or about the event on November 2nd that Dr. Shekhar and I can answer for you? Or anyone? Any specific questions?
So we have some questions here. I think there's a discussion is happening there in chat box. You guys can chat box, and some discussions are happening. And I would like to tell you also important thing here, and I'm going to share with you the screen of the upcoming conference. And this
Okay.
event is continuing to our next level of speakers photos here. Okay, let me check share. I'm going to share the screen. I have to go back to this one. See how can I share these things in the yes.
While you're doing that, Dr.
Yeah,
Shekhar,
yeah,
Amitabh Bhagat says
yeah.
we can control our internal environment. You are so right. I completely agree with you. We cannot control the external, but we can attempt to try to understand our internal environment and therefore pay attention to that. And you're absolutely right. I agree with that. Mindful Manny, why is our LOC so external, locus of control so external as we grow? Well, I think that's because we are social human beings and we are raised in families and we learn things as we grow up. Some of them are functional and healthy, but it is impossible not to also be unhealthy because of the way we relate to the world. Because like you said, we live in a synthetic society where more attention is paid to how you look, how much money you have, how much fame you have, how much power you have. We don't really raise human beings. We don't value things that really matter sometimes, which is the quality of our connections with people, how rich we are when we are connected to others, as opposed to just being selfish in our own goals, how relationships are always about win-win. It is never about, one person giving and the other person taking. It's always, it's a process of having a win-win experience for everyone. And actually, the more you give, the more you get. That's how love works. And that's how relationships work. But we never really figure that piece out. And yes.
I was just wondering if you were familiar with any research, because I'm not. So what I normally do, I run groups called the Power of the Mind, and
yes.
As Mindful Manny, and my colleagues came up with that name, so I just ran with it.
I love that name.
I work a lot on breathing techniques and bringing the person out of their mind. I give them permission to be out of their mind and into their body. So the way I explain that is more intuitive, because I do it in a way that everybody can relate. First of all, I say our creator gave us eyes pointing out. And then as children, we're discovering the world with toys. And then as when we're chasing the ball that goes across the street and a car almost kills you, you either get traumatized by the horn or some adult screaming at you, hey, you stupid kid, you got to look both ways. And so we're constantly in what I've learned to call it exteroception. I don't know how common that term is, but it makes perfect sense. And as we grow older, we live in a win-lose world. So the competitiveness, whether it's in sports or in any other arena, it's about win-win-win out there. And obviously, we get into varsity sports or college or whatever, it's more of that. And we get into like what I call elite levels exteroception, whether it's athletics or in the military. It's pushing the human potential to extreme exteroception. Not to mention, if you don't fit in any of those categories, not to mention capitalism and consumerism, right? Hollywood, Madison Avenue, it's just buy, faster, don't think, just buy. And so mind body to me is having that understanding, and then flipping the switch is going from exteroception to interoception. And this is the boundary. Just close your eyes if you feel comfortable doing it, and trigger your interoception. And the minute like I established what I just said, it just changes. It changes everything, because now they have the whole time they're developing a curiosity of when is he going to talk about the inside, and that's where I want to go. I want to go to the inside, to the heart, to the belly, to the grounding, right, which is the soles of our feet. So powerful.
So you asked about research, Manny.
Yeah.
You asked about research. Well, there's a lot of research that talks about mindfulness being extremely effective in working with trauma. There's a lot of research on meditation having incredible impact on reducing stress levels and reducing, your reactive nature, where you just react, you impulsively react to things emotionally without really having that kind of a laid back, comprehensive, like you're not, basically what is stress? Stress is you're always in that type A, your sympathetic nervous system is active, you are constantly stressed out, and the parasympathetic nervous system really is about you being calmer, being able to make more educated, informed decisions. So they've clearly shown the connection that what meditation, what herbs, what being outdoors, being in nature versus, constantly being in the city and being indoors and being in restaurants and loud places, etc., versus being outdoors, connecting with nature. All those things have been researched extensively and conclusively shows that the more you are with nature, the better it is, the more you are connected with something bigger than you, being
Lakshmi,
outside.
I'm sorry for interrupting you. My question that I put in the chat box was, because I totally agree with you and I understand that part. I've read a lot of the research there. My question was the locus of control. Like, what is the primary mechanism as to why, as we get older, we become so fixated or externalize our locus of control so much? What's the main primary reason?
Yeah, so there's no one reason, because we are a complex interplay of our genetics, our environment, and our experiences. But typically what happens is when you are, as you become an adult, if you realize that you have so many doubts about who you are and you're trying to survive. All of us are trying to survive and do our best every day. However, some of us are more handicapped than others because of our life experiences, because of the way we understand, we make sense of the world. And so when your locus of control is more external, it is because you are more focused on achieving and acquiring things outside of you, where your view of yourself is really through the eyes of other people around you, where you are less connected with your body, you're less connected with your own experiences, you don't follow your instincts because you are more conditioned to follow what is outside. So therefore, if my neighbor is buying a new car, okay, he must be doing so well and I need to buy a new car, only then that'll make me happy. Well, it's like a child, right? A child who wants a new toy, the child is happy with the toy for how long? For a day, 2 days, a week. Then the child wants another toy. It's the same process of us when we are in an acquiring mode, always wanting what other people want, other people have, always feeling like I'm not good enough, I'm not smart enough, I'm not pretty enough, I'm not rich enough. You get into that pattern of using your locus of control is always external to you. So it is conditioning. So the short answer to your question really is, it is because of our conditioning, our life experiences, the way we have learned to navigate the world as adults, and the society's excessive emphasis on things that are not internal.
Interesting.
Success, everything in life is about success and money, isn't it? I mean, that's what even children, what do you want to be when you grow up? Well, I want to be a doctor because I think I'll make a lot of money. Or when I grow up, I want to have a big house. Tell me, I've had people in career counseling say to me, when you do an interview before you actually do the testing around it, the first thing they'll say, a child will say is, I want a job that makes a lot of money like my uncle. My father has no money. We always, we don't have enough money, but my uncle is really, really rich. So I want to be what my uncle is. So what does your uncle do? My uncle's a doctor. Is your uncle happy? Oh, I don't know, but he's rich. We don't even, as children, the way we raise our kids is really just to acquire. You're just getting, all parents say, I want my kids to be educated, have a really nice job, have a beautiful house, a white picket fence. I want them to have everything they've always wanted. Nobody really talks about, I want my child to be a good human being. I want my child to be grounded. I want my child to be self-contained. I want my child to be able to regulate the ups and downs in life without too much difficulty. No parent tells you that. Parents always want to say, I want my child to be smart, educated, has a good job, makes good money, has a good life, marries a good girl, pretty girl, marries into money because then they won't have to worry, has a good inheritance. This is the way we view the world. This is how we define success. How much pressure that puts on us, right? So one of the things in therapy we always say is that when you start thinking that I'm not good enough, right? Or that you feel that I'm great, I'm so successful, I'm the best, because you also have that issue, right? People who believe that they are everything that they, that somebody else is not. I always say that you will always find somebody, no matter how pretty you are, prettier than you, no matter how rich you are, richer than you, no matter how successful you are, more successful than you, no matter what car you drives a better car, no matter what house you live in, somebody lives in a better house, no matter what country you live in, they live in a better country, no matter what beach you go to, there are better beaches out in the world. Doesn't matter. It's like it's a quest that is meaningless. Ultimately, it is about, once you go to that best beach, what is the guarantee you're going to feel good there? People say, I'm going to take a vacation. I'm going to go to this fabulous beach and I'm going to spend all this money. And you go there. Yes, you're okay. There's a novelty factor and you're happy for the first day. And then you realize the second day, you are still you. Your problems are still there. You still feel the same way. You have the same patterns. Then what? Right? So everything is internal. And I mean, I'm rambling now, but you get my point. We are conditioned to value things in life that are external to us as opposed to developing who we are to enrich the quality of our interaction. And we are always, we're celebrating competition. We don't celebrate collaboration. We don't celebrate consensus. We celebrate individual successes. We don't celebrate collective successes. We're not a collective society. Western society is predominantly individualistic. That is why you have so much innovation. You have so much, so much great stuff happening, so much science and so many inventions. But the average person is very unhappy. If you look at the happiness index in the world, I think the last I had read about it is in Nepal. The people in Nepal said they were the happiest people in the world, or their happiness index was much higher than the Western countries. And traditional older societies tend to, you find this. I mean, I travel to India quite a bit. I travel to the Far East quite a bit. And generally people there the average person seems to be happier than the average person in the West, even though we have more. They seem to be happier. So acquiring things doesn't make us happy. Somebody has asked here, okay, this is a very important question. Anthony Cortez asked, do either of you feel that medication or herbs can play a temporary role in healing trauma while people get grounded enough to do the deeper inner work? Absolutely. I believe that. Short-term targeted medications in severe trauma is necessary for you to get to a point where you can do other interventions and benefit from it. And when you talk about trauma, one of the things I wanted to mention today is, and we have passed our time, is really to recognize that when there's trauma in our lives, it affects every aspect of our life. there's a whole series on trauma and our relationship with food, trauma and our relationship with money, trauma and our relationship with how we make friends and how we spend time with friends, trauma and anything that you do in life, your relationship with that is affected by your past traumas and your current stresses as well. So it's one of those things that encompasses every aspect of your life. And my hope is that we can, have some insight on how exactly to recognize that and get to understand our traumas better and how we play our traumas. Which part of the body do I hold my traumas in? What are the weak spots? How do I feel it? What do I need to do to recognize it and to heal it from the inside? Okay, I'm going to stop now, Dr. Shekhar, because I do have an 8:30.
Yeah.
So I would like to.
Yeah. So
and if you have more questions,
good
email
discussion.
us.
It's a very good discussion among the group of people, even though it's a small group. But
Yes.
this we are going to share with all the 113 people who are registered for this today's session. And we have ongoing series is going on. This is never ending. And next webinar, Zoom webinar will be there on the September 16th, that is Saturday, 7 p.m. Eastern Standard Time, 7 to 8. So what we request you, all of you, you tell your friends to register again. The people, again, this registration is ended with today. Again, you have to register for the separate link, where you have a separate link is shared with you. You have to register and share that link with your Facebook, LinkedIn, all your friends, whoever benefited, your patients, your clients, your yoga teachers, all the people can share this information to everybody. That way, what happens, more group of people are coming, more questions will be there, more answers will be there, more solutions will be there. Really, it's a good platform we are creating. We are creating definitely a healthy world. Healing not only yourself, you are healing your community, your friends, your colleagues, and we are living, then we can live in a happy heaven on earth. We can live in a heaven on earth. We really enjoyed it. Thank you very much, one and all, for giving an excellent presentation and a discussion, and everybody giving an input. And Manny here, Manuel is here, and as well Lakshmi and myself and all the participants. And Anthony is a registered nurse from Florida.
Oh, wonderful.
Also APNA member. And
very nice to meet you.
We hope we will see him in the Pennsylvania in November. Anthony, you should come. And all the participants, not only Anthony, here Usha Devi Pillai and Teresa Barry and Kristen is here and Teresa is there, and Neil Parmeshwar and all the people, and Manuel and all the people, whoever participated today's presentations, they should all be present in person. We are going to shake hand each other, hug each other, connect each other, knowing about each other, and share the wisdom of each other, share our business cards and everything. We connect each other, we give a referrals to each other, and somebody who as a friends are there. That is the reason we go to the conferences, to meet with the like-minded people. When we go to the like-minded people, we are not able to conquer the whole world. Then think about that. You are a small, minuscule in the world. You are in the 7.5 billion population. You are the one unit. You are the only one person. You have your own drama is going on. You have your own drama is going on. That drama has to come out of that, and you have to come out of the drama and then enjoy the time, share the wisdom and the knowledge and everything. Then you connect with the people, then you will heal. A lot of times when I do this conference, this 56th conference I'm doing, this is one way of healing my healing. This is one way of connecting the people. And now I know more than about 5,000 speakers around the world, 5,000 speakers in the world. I have a list of the speakers who are, I invite everybody to come. Now recently, NIH has contacted me to do research on the cancer care and cancer research and everything. I will be involved in everything. I am living in Ayurveda, and I'm going to die in Ayurveda. That's the way you have to look into that. You have to be passionate for your work and everything. And that is the thing, when you are instill your passion, you will never be tired. And I always say that I am not working. This is my hobby.
Right.
12 hours or 15 hours I do with my work.
Right.
That's not a work, actually. This is you are passionate, you are what you are doing, you are caring about your people, your clients, everybody whom you can support them. Thank you one and all for giving a wonderful time. Lakshmi ji, namaste. Thank you one and all. Namaste.
Thank you so much.
Thank you.
Thank you so much. I
Thank you
look
one
forward
and
to
all.
seeing
Thank
you
you.
all. Thank you.
Thank you one.
Thank you.
Namaste.